Okay, so we're gonna go over, today is our last day together. And I've written up there all the things we're gonna discuss today. For next week, you don't have any work that needs to be completed once you leave here today. For next week's work, it'll go live Sunday night, okay? So don't worry about reading anything or going over anything specific this week. You get a week off. You're welcome to read ahead and read into that chapter, those chapters that you'll have, but they're going to be on the learning path next week, so I would not stress over it, okay? How does Engage go, the learning path?
I just had a question about the, when you click on the note, lecture notes or whatever, I clicked on it and all it was just telling you what's, and I didn't have any notes. We're supposed to make the notes?
So you guys tell me, I can't see the way it looks on your end, but is that where you can highlight things and it saves there? What does the lecture notes look like?
Is that where you hit on the link and it sort of like a PowerPoint?
I'll look through it. I'll look at it today before you leave. Were you able to access the recorded link of me lecturing? Did everybody hear my kids in the background? They were spying on me while I was trying to record, and I'm sitting there doing this as I'm talking, and then one of them Tues. I'm like, guys, go! So I promise they'll be entertaining. Probably won't be very quiet, but too much work, not enough work, took a long time, not very long. What'd you think?
I didn't get to get on it.
You did not get to get on it?
I couldn't find it.
Okay, we'll go through it today. We'll plug it in and we'll look at what you should be able to see. So yesterday's class, their biggest concern was they felt like it was taking a long time. There are a lot of activities, there are a lot of things they need to click on. And I don't think that I made it clear enough that moving forward, once we go virtual, you're supposed to have seat hours of 5 hours a week here. So that means part of that time is going to be listening to the lecture that I pre-recorded, but the rest of that time is working through those activities. 5 hours in class is what you're supposed to do for seat hours, but then typically you're supposed to study beyond that. So 5 to 7 hours a week is what you should plan for. I know it's a lot of activities to work through, and moving forward, we're going to have a handful of chapters every week. So it will take some time. It's fine to break it up over multiple days. Don't feel like you have to do it all on Tuesday, okay? Once we move into the test, so your first test I've got over there will be October 6th. I will let you know. I will email you ahead of time. I have to figure out how the tests work, if they'll allow you to take it anytime during the week, or if I need to set a specific day. I will let you know ahead of time now. So be on the lookout for emails from me. It will come from the allison.jenkins.10@gmail. Okay. Other things with Engage, there was questions yesterday about some of the reflection activities. They felt that the questions were not things that I said in the PowerPoint or in the lecture that were important. What I plan to do is emphasize within that pre-recorded lecture what I really want you to know. Now, those reflection activities that are not graded, they may have questions that I didn't emphasize in the lecture. Once you're taking the actual test, though, I get to pick out the questions that I want on the test. So if I'm saying this is important, I do want you to focus on those things because the test will reflect that. A lot of the information that was in the chapters last week was just kind of filler. Like, I don't think it's important that you guys know about the history of medicine all the way back to the start of time. It's interesting, but it's not something that you're going to need to know moving into the work environment. Okay. Questions, concerns about Engage?
I just wish I had a book.
A book, yeah. There is a book. Have you checked on Amazon?
Yes, like 50 something.
Yeah, it's pricey. It's pricey. But maybe used. Did you check used option?
Yeah. When you do the what's called with us, is it going to be coming up? The thing you sent us to actually get
Do
up?
you have it pulled up right now?
I have seen it.
Okay.
Is it on here?
No. So it's going to be open from Sunday to Sunday each week.
Oh, okay.
So because it's already a week, it's not going to show. Now you can here for next week, it's got activities. You can't access them yet because it'll open on Sunday. And that's, I'm not sure if you guys heard when I said that.
Yeah.
Engage is complicated because it will only let you open something for a certain amount of time. And it won't show up in the correct week if I add it beyond Sunday night. So then it would pop it to the following week. So I was trying to make it easier so you can see it by date, and by week of our class. So it's Sunday night, it's the same thing for the Monday class, it's Sunday to Sunday.
So there won't be anything until this.
Right. Yeah, nothing will, you won't be able to access the lectures or any of the material. Now you can always look through the book though. You can always go to the full book and read through the chapters if you want to do that ahead of time. Okay.
That's what I've been doing.
Yeah, and that's fine. The learning path will just take you through it step by step and I'll ask you questions along the way. It's just a little more interactive. It'll be easier to try to finish all those activities if you're clicking through the chapter that way.
Okay,
But it is time
activities, where
consuming.
do we find activities? I know we have questions.
All of that's in the learning path. So you're just going to click every single link within the learning path for that week.
Mhm.
Yeah, I'll load it on my computer and show it to you during a break.
Oh, I didn't miss nothing.
No, I can see if I can open it back up for you to access.
Okay.
I did not create anything from last week. I just wanted you guys to be able to get on and practice the concept. Okay. You will be able to see when things are graded. It will say, it'll have like a red circle and it'll say counts towards grade. Okay. You shouldn't have, did anybody see that on anything last week? Yeah, should have done. Okay. So today we're going to go over finger sticks and we're going to practice venipuncture. We're going to use vacutainers. I like here's that. We're going to do vacutainers and butterfly needles. So we're going to practice. You guys get the really sweet arms. Unfortunately, on Tuesday class, there weren't enough of these arms, so we had to get different ones. So these will go home with you. Everything that you have at your desk today, I want you to take, there's a red biohazard bag in your container. I want you to put all of that stuff in the red biohazard bag and take it home with you. Now, what can you practice at home? You can practice injections, you can practice in this arm. I don't recommend you draw blood on family members. Personally, I don't. If you do that, it's at your own discretion. You absolutely have to use a clean needle. You cannot use a needle which you use in an arm. Do not practice any injections on anybody in your home, okay? Because those needles that you've been practicing with have been poked into the bottles, have been poked into the smiley face. So what I would recommend, this is a phenomenal arm. I don't think you need to practice on a person at home. When you go into the clinical setting, I'd feel more comfortable if you practice there, okay? These are really nice arms. They're very lifelike, so I think you'll be pleased with practicing on them. We'll also rotate through the arm up here. We have high school students coming into the lab today, so we're going to try to keep most of our activities in here. And then if there's any skill that anybody wants to practice again, if you want to practice EKGs or blood pressure checks, whatever is a skill that you think you want to discuss more, practice more, we'll do that today. Okay, so it's just going to be kind of a laid back day. We're going to talk about the chapter a little bit, and then we're going to do skills. Go ahead.
Can I practice this too since I was not here?
Yeah, and I've got your stuff in the office, so we'll do that. Other things, questions, concerns? How's everybody feeling about going virtual? Overwhelming? Nervous?
I'm not. Yeah, I'm hoping I can get it up and everything because of weight, other than an area where there's not much Wi-Fi.
When I did it from home, it worked well, other than I had to use the time for this internet technician back and redid our internet with us. So it worked well. But I think if you do it by your phone, the whole chart, better chart, the last thing is not have to be on the video. It's just be able to listen.
Yeah.
As well.
So if you have internet issues, if you're having trouble accessing things, please call me, text me, email me, okay? I am available. We have internet here. If you find that you're not accessing while home, the parking lot will pull the internet from in here. If you need to be near the parking lot, the library, there's hot spots all over Rappahannock now. I know some of you have a little bit of a drive, but for the school systems, they put up all kinds of hot spots. Most of the churches along here in Sperryville even are a hot spot too. So there are options, but just let me know.
Right.
We're trying, the reasoning for going virtual is to try to protect you guys, because we know we're going into flu season. Well, some of you already work in the environment. You have the potential to be exposed and then not be able to come to class. But when you add flu plus COVID, there's such a high risk. And we've got multiple missing today. One was exposed at work to 5 patients yesterday. So there's that risk. And the longer we're sitting in this room together, the higher the risk is. The masks help, the air ventilation helps, but you see it's an old building. It's not a perfect setup. So trying to protect you guys. And I know it's frustrating to go from in person, seeing face to face, to virtual. But I'm here to help you. We're going to be on Zoom every single Tuesday at 9. We may have to tweak the time just a little bit if I can't get my minivan all the way back to Orange in time. Not the kids off, but I'll let you know. But
Like me, I was a little bit late this morning to get out of work, and sometimes I don't get home till like a little after 9. So
okay.
I might be a little bit jumpy.
We'll try for 9, and if we see that 9:15 or 9:30 works better, then we'll go with that. Our plan still is to just stay on for about 30 minutes. The other thing, so every Tuesday 9 a.m. Zoom. If we need to, we'll tweak that time.
Will it go to 2 o'clock or stay at 12?
For the Zoom, no, just 30 minutes on Zoom. So
So
we're
we're doing
yeah.
30 minutes a day on Zoom?
Yeah, and then you're going to watch the pre-recorded lecture.
Oh,
So that lecture will be a link within the learning path. Yeah, so we won't lecture on Zoom. It's too hard when it's live and everybody has things going on at home. Plus, our house is a mess. I mean, just chaos, but in and out, dog. And so I'm going to pre-record ahead of time so that you can actually focus on what I'm saying. And you can watch it whenever. Let's talk about final projects for a minute. You should make sure everybody has it on their desk. You have their grading rubric for the final project. So I think almost everybody was here except you for last week. You can choose to do it with a partner if you want. You're welcome to choose your own partner. Typically, we choose the partner for you. You have to work with somebody else, and we do a presentation in class. We're going to have to do our presentations on Zoom because we're going to do them at the end of the class time. So I would rather you pick your own partner, whoever you feel comfortable with. You know, obviously, if you're going to meet face to face, I want it to be somebody you're comfortable with. If you want to do it on your own, that's completely fine. 5 to 10 minutes, regardless of whether or not you have a partner. We will present on Zoom, and you do need to have some sort of visual. So last semester, somebody used a PowerPoint, somebody else made a poster. One group did, it looked like they were doing the respiratory system, and it was a 2-liter bottle, and they put a straw in there, and they put balloons and inflated them so you could see what looked like lungs. So be creative. And you don't need to spend an extensive amount of time on this. You're going to teach us something, and you get to pick the topic. So before we leave today, I want everybody to have come up with their topic, and if you want to have a partner, tell me that too, okay? So pick the topic, and then go ahead.
What kind of topic?
Anything. It can be completely broad. It can be the body. It can be the muscular system, musculoskeletal system. It can be nutrition. It can be diabetes. It can be very specific. It can be very broad.
Okay.
Anything health related, body related.
And when is this due next week?
No, I want you guys to tell me your topic today and who your partner is if you want to have a partner. And then we're going to present in December. So we'll take turns over Zoom.
I like it.
Yeah, usually we do all of the presentations on one day on Zoom. And it's like last time it was like 2.5 hours long on Zoom of everybody trying to present. It's too much. So we're going to space them out. We'll do 1 or 2 a week. Yeah, that's true. Okay, question. All right. First thing we're going to do is play a game. Some of you, I think you two probably, did anybody else take their stage here? Okay, so we're going to play a game. If you know what the game is, please don't share, okay? It's called the green glass door. Have you heard of this? You guys heard of this? Oh, good. Did you heard of green glass door? Okay, if you know or if you catch on, don't give answers. You can help give hints. Do not tell. Okay, so there is a green glass door. We're trying to figure out what can fit through that green glass door. Okay, I'm going to give you some hints. A tree can fit through the green glass door, but the desk cannot. A bunny can fit through the door, but a cat cannot. So start asking me some questions, something you think it might fit. A sheep can fit through the door, but a cat cannot. A horse.
Okay, so for me, and a sheep, a tree.
A tree can fit through the door too. The floor can fit through the door, but the desk cannot. Okay, ask me something to fit.
A horse?
No, horse cannot fit.
And people.
Nope.
What about dog?
Nope.
Is there any more that can fit through it?
Oh, yeah. No, shut up. Okay, a coffee cup can fit through the door, and the tea cup cannot.
So you're talking, no,
All right, ask me a question.
Yeah, we good.
something was.
Me too.
Things.
Ask me if something can fit.
All right, it's something can fit. A car.
No. A what?
Addition.
Addiction? Yeah, addiction can fit.
School.
A school can fit. An office can fit.
Hospital.
Nope. Hospital cannot fit. My minivan cannot fit. The Jeep can fit.
Can we fit?
Yeah. Zach's Jeep can fit. What'd you say?
Can we fit?
No.
I'm totally.
I am taking this, got me far.
Okay.
You're all my long, you're my.
Actually, I think that I can fit.
You can fit,
I can fit.
but we can.
Right? I can fit. And I can fit.
Okay, so.
Allison can fit. And that can fit.
Is this something to
Grace
do
cannot.
with your education?
Keep asking me questions. What is something can fit? Luke is engaged here.
The mountain.
A mountain cannot fit. A pool could fit.
What about tractor trailer? Would it fit? What about English?
What kind of,
Rescue.
what?
A rescue squad.
Oh, ambulance. Sorry, I said ambulance. No.
Wait,
ambulance
food?
cannot fit. What?
Plate of food.
Food can fit, yes. The plate cannot.
Okay.
And we're supposed to figure out what this is. Oh.
We gotta figure out why certain things can fit on the can. Here's a hint. Start writing these things down. You have a piece of paper. So the floor can fit, but a desk cannot.
What was it?
Oh, you can.
Right. And you said a bunny can fit, right?
Fine, you can fit.
But a cat can't.
Right. The grass can fit, but flowers cannot fit. Don't look at how you said that. I see you Googling. A happy person, this is important. A happy person can fit, a sad person cannot.
A happy person can fit.
A happy person can fit, a sad person cannot. Overalls can fit, blue jeans cannot. Coffee can fit, tea cannot. Anybody see any similarities?
It's like an opposite of something.
A deer can fit, a toad cannot. It really, it gets frustrating, doesn't it?
Yes.
Okay, a puppy can fit, a dog cannot. The moon can fit, the sun cannot.
Can a baby fit?
We can't fit, she can fit. But adults,
You said the moon can?
The moon can fit,
the
the sun
sun can't.
cannot.
What about stars?
Sorry, no. Your needle can fit, your gown cannot. You're gonna be angry at yourself. You're like, oh.
Teaching over the kids.
Anybody noticing anything yet? Challenge, yeah. Challenge can fit.
What can?
A challenge. The glass on the windows can fit, but the actual window cannot, the whole window cannot. A hammer can fit, but the nail cannot. Both an assistant and a boss can fit through the door.
A boss and assistant can fit through the door?
Yeah, both.
But what can't?
Yeah, doctor cannot fit. Neither can a nurse.
Is there a classroom?
A classroom can fit. Your hand sanitizer cannot fit. Your cell phone can fit. Your keys cannot. I ask you some questions. Is anybody catching on?
Nope. I'm far out. I passed on.
You catching on?
I give up. Because I mean, it's one little thing, and then all of a sudden it's a big thing that's going, and a little thing, big thing.
Okay, maybe it's not five.
It's not something.
Is it balancing?
That's what it is. That's a good one. Pepper can fit, salt cannot.
What can fit?
Pepper.
Pepper?
Feet can fit, but not toes. Hands cannot fit. Apples can fit, but not bananas. Okay, ask you another question. Ask if something can fit.
Can those three things fit?
Yes. All three of those things. Green can fit, black can fit, and door can fit through the door.
What about the chair? No chair.
This bottle can fit.
Did the TV fit?
Neither can the stove. A rabbit can fit, but not a hare. Anybody catching on?
No.
Okay, look here. You're gonna shake your head. What do you notice? Tell me some of the words that fit.
ESO.
No, tell me some of the words that fit.
Keys.
No.
Floor.
I mean,
Floor.
cell
Noon. Noon.
What else?
phone.
Yeah, cell phone.
Oh, I got it now. It's double letter C. The one that can fit in single
Pepper
letters
fit,
again.
right?
Yep.
Anything with double letters fits through the door. Isn't that ridiculous? You're like, oh, it's big and small. It's a baby, it's older. Okay, that's enough of that. Want to do back your brain today. Think of something different. Okay. Okay, so this is second. Make sure that one of our students can get on. Okay, so let's talk about chapter 44. And you don't really need to write anything down, you can just listen, okay? These are all things, that's something that I told the group yesterday. Every single one of these chapters that we've gone over since you started class, you're going to see again. So later in our semester, you're going to be expected to read that chapter again. If you've already read it, just skim it the second time. But my reasoning for that was that I wanted you to at least get exposed to the terminology before we come in here and try to practice these things. I don't expect you to know every single little thing about it, just like the EKGs last time we were here. I don't expect you to understand the concept of all the leads and all the heart waves right now. I just wanted you to familiarize yourself with it, and then you'll see it again later this semester. Okay, so first thing we're going to talk about, does anybody have their procedure lists from last time? Where were they out here on the desk? They were last time. Okay, so we're going to go over procedure 44.1 and 44.3 today. First one, puncture skin with a sterile lens. Okay, so let's talk about that capillary blood collection. Okay, this is very, very common. This is something that you will do in an office setting. This little thing right here would be what you'd be sticking with, something similar to this. It is a very tiny needle, and you're going to be usually pricking fingers. So for an adult, an older child, it'll be a finger. For a baby, does anybody know where?
Heel.
Heel. Yep, we've heard of heel stick when they're newborns in the hospital. Okay, so finger or heel stick. These in your finger are tiny little blood vessels. Okay, but the thing is, a lot of people, this really hurts them. If you've had your finger sucked before, it can really hurt. The important thing that you want to know about where to stick, and there was a picture in your chapter that I thought was really good. It showed location. So on the sides of the finger are the best option. You don't want to hit along a nerve. You want to go along against the grain of your print. Side of a finger. They say ring finger, middle finger. A lot of places commonly do index. So it's interesting to read that. They suggest you're going to use these less. That's part of the reasoning. So third or fourth finger along the outer section, okay? When you are checking a blood glucose, like with a glucometer, if a doctor says, I need you to go in and check so-and-so's blood sugar, you're going to be taking in gauze, alcohol prep swab, a lancet, your glucometer, and what else is missing? Test strip. Okay. You guys do have a test strip in your skills kit. If you choose to practice with that with your own blood, that's completely fine. We're not going to actually put it into our glucometer, but has everybody seen a glucometer before? So you're familiar with it. Okay. Okay. So when you're testing somebody's blood sugar, wash your hands, put your gloves on, gather, make sure your supplies are gathered before you wash your hands and gloves on. You're going to take a swab. You're going to clean their finger. Let's do fourth finger, since that's what the book says. Right in the middle, and then out circular, just like all of our other procedures, okay? Do not blow on it. Do not swipe your hand over it. Let it completely dry. Next thing you want to do is open up the cap of your lancet, okay? You have to open it up so that the needle is able to be accessed. You also want to have gauze ready. Does anybody know why?
Bleed.
Well, what should you do? Yes. You are going to poke them. You say, okay, hang tight, little prick.
Yeah.
Poke them. The first drop of blood with the glucometer reading, you're going to wipe off. You're testing blood sugar, wipe the first drop of blood. Because there could be some alcohol left in it. There could be some liquid from within the capillaries, that interstitial fluid that's still on your finger that's come out of the blood. Wipe the first drop. Are you doing okay?
Yeah.
Okay. Wipe the first drop of blood. Second drop is what you're going to use. You can, if it's not coming out well, you can gently squeeze to increase that amount of blood. You're going to put the test strip right up to that dot of blood. It'll go right into the test strip. Put the test strip right into the machine. Okay. Now, times when you should not wipe the first drop of blood would be if you're checking an INR level. So somebody who's on Coumadin or some sort of blood thinning medication, those patients have a specific machine within the office if you need to check their INR level. You do not wipe any blood off because you don't want to push the finger, you don't want to take away the first drop because that could affect the clotting results. Okay?
INR?
INR, yes. And each office's machine will be different. Make sure that you're trained on that before you try to use it on a patient, okay? Glucometer is a little more clear cut. It's going to be a power button. You're going to turn it on. And usually it's going to be ready for you to put the strip in. It's very obvious what to do. With the INR, you want to ask and you want somebody to walk you through that before you do it. Because an INR level is really critical for a patient on blood thinners. They need to have that correct result. You don't want to alter that result at all because it'll affect how they're changing their medication levels. And with Coumadin, if they're on too much Coumadin, if they were just to walk by the table and just gently graze it and nick it, they could start bleeding and they would really struggle to clot. So it's very important with the iron. Okay, another thing to know too with explaining to a patient, if you are doing the patient education, if they're just found out they're a newly diagnosed diabetic and you're supposed to give them this glucometer in the office, you're going to be explaining this process to them, okay? And part of that, if they don't have alcohol pads at home, you can encourage them to buy some. You can give them a handful of them to use once they get home. But washing hands with soap and water in the home environment is considered okay. It's acceptable to checking for a blood sugar reading in a home environment. Alcohol tends to dry out the skin, so they say soap and water is fine. For our office environment purposes, always use an alcohol swab, okay? All right, so infants and newborns, lateral side of the heel. We're gonna talk about all kinds of medical terminology in a few weeks. Medial is towards the middle, lateral is outer. So outer side of the heel would be, you guys can see how unflexible it is. Outside of the heel, okay? Nothing popped. Okay, other things. Questions about that? I think that's all I want you to know about glucometers. Now, if you want to practice on yourself using that lancet, you're welcome to. If you want to take it home and practice, that's fine. Or if you want to practice right now, we can take some time to do that. If you're interested in practicing right now, I want you to go to the lab and wash your hands well first, and then I want you to glove up your opposite hand, okay? So, totally up to you. I'm fine if you want to just take it home with you. Before you leave today, though, I want you to grab a new pair of gloves to go home if you're going to practice any sort of finger sticking on yourself at home, okay? Because those gloves that we use that are in your skills kit are not considered clean, okay? Those are just for practice. You'll be putting them on and taking them off. Okay, does anybody want to practice the finger stick now? We're all good? Okay, that's fine. All right, so let's go to the venipuncture.
You have an extra paper. I don't have.
Yes, I'll get you a copy. Yeah. Let me make a copy of this one right now. So it'll be easy for you to screen. Okay, hang tight for a second, guys. If you want to, go ahead and pull out. See if you have a blue. This blue Chuck's pad here. I want you to go ahead and pull that out and put it on your desk. Okay. So clear off this spot. We're going to talk about venipuncture, then we're going to start practicing. Be careful if you have online clothes because if that blood does leak at all, it's not real blood, it is water with a red powder, but it doesn't stink. Okay, so just be cautious of that. I'm going to put that blue pad out and I'll be right back. We'll have plenty of time. We're gonna have time to play. Does everybody have your stuff? Okay, so when you're done practicing injections, practicing blood draws on the little arm, you've done those needles, I want you to push the safety on, and I want you to put them in the container and tail set. If for some reason your needles do not fit in that urine container, I want you to put them in like a Gatorade container, something with a lid on it. Keep it tight, keep it away from family members, away from kids, and I want that to come back with you when you return your still fit. Okay? I don't want you to put any sharp needles in your trash.
I have sharp container.
That's fine. If you have a sharp container at home, discard them in the sharp. That's fine. But
Yeah, because my granddaughter has.
Yeah.
Sharp.
that's fine. That's fine. But most of us don't have a sharp container at home, so if you have one at work, that's fine. Discard them at work. That's fine with me. Just don't ride around in the car, don't leave them out of the house. Oh, it's pretty big. Okay. The other thing to remember too is please be careful about if you have kids in the house. Just don't leave it down low, okay? I don't want anybody to be unnecessarily close.
Yeah, I'm gonna put mine in the bag.
Yeah, so
My
we're
backpack
gonna,
bag or something.
yeah, so everything back, not sure if you want to set it, but at the end, before we leave, I want everybody to put all of their skill stuff into the red biohazard bag in your container. You'll take all of that home. And you should have your stethoscope and your blood pressure cuff, except that that's your those will go home with you too. Keep those home, practice with those. At the end of the semester, everything comes back in the bag, okay? Before we need time. As of right now, we haven't heard clinicals or go yet. As soon as I hear something, I will see you now. If it's after today, okay? So keep on looking for the number. Hopefully get you guys in. It's just our board has to approve it. The family practice is built to let you guys in, but the board is concerned about you guys getting exposed unnecessarily. Okay, so we're gonna pivot for a second. I'm like a squirrel this morning. All the things I want to tell you. It's always on my desk, and I want to practice these before we get bloody. Okay, so these are sterile gloves. We're gonna practice the concept of opening a package, opening up the gloves, putting them on correctly. Has anybody done this before? Sterile gloves?
I think I had when I worked at the office.
Okay.
I was training.
Yeah. So a good time to use a catheter, like a straight cap in the office. You need to get the urine out. Because that catheter is going into their urethra, up their urethra, into their bladder, that's considered a sterile procedure. Another time would be if somebody has a large boil on their back and they need to do an incision and they need to debride it, they call that an IUD. They're so cool. If you haven't seen one, they're pretty cool. It's stinky. It smells really bad because it's like a lot of pus in their back. They'll actually use a lancet. I think it's so cool. Use a lancet and they will usually squeeze, express all the pus out, and then they have to. Is everybody okay? We got eyes rolling here. And then they have to suture it back up. So the process of opening somebody's skin, inserting something into the body would require sterile gloves. Part of sterile gloves too, usually you're creating a sterile field. So you have the sterile gloves on. You may have to open a urinary catheter box. You open up on the corners without touching, and then you put on your gloves. Before you touch anything inside of a sterile kit, you put on your sterile gloves. Once you have sterile gloves on, you are not walking around touching the mouse, checking something for the provider. You're not touching the doorknob. You're not touching your cell phone. You're not touching a pin. You're not patting somebody on the back. Your hands are completely sterile, and you don't touch anything except what's on that kit to hand to that provider. Okay? It's good to remember because I'm sure you guys have been in the dentist's office before and see them put on their gloves, and then they're doing something in your mouth, and then they're touching their mouth, and then the dentist comes in, and they're touching the mouth, and they wash their hands, and then they touch your mouth, and they go back to the mouth with the glove on. Has anybody seen that? Mm-hmm. It's horrific.
And I've told them out of it too.
Yeah, it's horrific. Okay, so you have 6 and 8.5. So 6 would be more like a small, 8.5 would be like a medium large. Okay. So leave them right in front of you for now, and we're going to go through the whole process of opening.
I've used hours.
8.5. Okay.
Hold it.
8.5.
Yeah.
8. Okay, let me go get one more. You guys don't have to be quiet. It's church mice when I'm out. You're welcome to talk. Gotta get the code, sorry.
Anybody do good on the quizzes? Did you were you able to go and get through real quick? You know, you could go back over and restart it.
What was it?
With the camera center.
I mean, I see the questions, is that what you're
Well,
talking
yeah, the quiz.
about? But you can't answer.
I'm learning.
Yeah, there's a questions at the end of the,
Yeah, there's like reality check and stuff like that. on there.
but you can go in there and answer stuff. I can't find it, wait, I'm gonna do this.
So when you go to where the weeks are,
Uh-huh.
then you hit that little drop down and then on activities.
I don't know. I'm just reading the book and going with it. And I answer no questions or anything.
Problem?
Question for reality check question.
I haven't answered the one because I didn't know what it was.
Okay, we'll look through it. We'll go with these today. Okay, so why don't you guys go ahead and stand up for this? I think it's gonna be easiest. So we're gonna start out pretending that we've already watched the meeting, okay? Please always do that before you. All right, so we're washed up. Go ahead and grab it and open the top. Hold open. Outside of it is not really, you have the outside. Put it pressure down. Just push it down to the side, plastic. And go ahead, yep, that's fine. So, corners, we're touching only corners. Use your non-dominant hand, open the top corner, so it doesn't slide out. And put it so it's facing the front for us. Turn it. Yep, there you go. All right, very good so far? All right, so bottom flap open, you push it down a little bit. Same thing with top flap. It's going to push back some. We don't stick your fingers there again, okay? All right. Ready? Now, do you see those tiny little fins? Right here. The tiny little fin pieces on the front, on the left and the right side. I want you to grab those. We have to just pinch them. Open it all the way up. Everything on the inside of the package is sterile. Do not touch it. Hold your paper. Hold it. Keep it open, okay? Everybody ready? There you go. Okay. Use your non-dominant hand. Grab pinch right here at the wrist of your right hand, if you're left-handed. Is anybody left-handed? Okay, you're left-handed. Okay, so you're gonna do your right. You're gonna grab your left glove first. Use your right hand to grab your left glove. Yeah, you're confusing me. Okay, take your right hand and use your left hand to grab your right glove.
Okay,
Use your left hand to the opposite.
grab the right one.
Uh-huh.
Okay.
No, your left glove. use your right hand to grab your left glove.
I got it.
Okay.
I'm ready.
So,
Okay.
our right hand is left, left glove right, right?
If you're right-handed, I want you to use your left hand and grab your right glove. Yeah.
Right, okay.
Okay, go ahead and grab at the bottom. And go ahead and put your right hand in. Do not touch anywhere above the glove. Keep it pinched at the bottom, put the glove all the way up. Do not touch it, do not touch it, do not touch it. Do not touch anywhere in the glove yet.
No, I was just.
Yeah, don't touch it.
That's fine.
So see how it's rolled up? So this is actually the underside of the glove.
Okay.
Hold it all the way on. So this is a really good example. If it doesn't go on well,
Yeah.
that means you need to get a new pair, okay? Probably it's not the right size. It may be too big. Like hers is too small, yours looks way too large, okay? We're just gonna practice the concept. If that were to happen, you need to discard it and we're gonna wash your hands. Get another. Okay, once you have this one on, you not pull all the way down, leave it just like that. Now I want you to take your right hand, if you're right-handed, loosen your left hand, the gloved hand, and I want you to stick at least 2 or 3 of those fingers underneath the cup of your left glove. Got that part? Go ahead and open it up. You can hold the corner of your paper if you need to, only on the far corner. And then go ahead and glove that left hand. Put it on. Now, when you put your left glove on, you can go ahead and pull this one completely down. The cup completely down. Once it is on, now take your left hand and pull this cup down, okay? Because the out, where you're pulling it down is going to be considered sterile. Once you have completed that, you don't touch anything except what is on the tray, okay, for the procedure. Do not go anywhere, do not store, do not touch objects, that's it. Okay, now, I'll help you. That's okay. No, that's okay. Okay. Now, to take them off, same way that we learned before, okay? So you're going to grab your non-dominant hand, pull it off. And same thing, stick your finger under your dominant hand and pull it completely over. And then just start, okay? So go ahead and practice that under your glove. To practice this, you can just kind of flip them around a little bit. Just remember to leave it cupped at the bottom of the book, okay? So I want you to put them back to their original form. And what helps too is you got a picture here on the opposite side, okay? So you can see which way it is. Situated. Make sure you cup it. Because I have my gloves and stuff right now. I'm going to come over and help you. Cup it. Put it completely back together. Fold it back up. All of your folds. And I want you to practice from the start all the way through the end. So now, no, you're just great. Now go ahead and put your hand over and flip it upside down. Flip your hand upside down. Yes, when you're putting these gloves on, keep your palms up, okay? You're gonna slide them onto your palm. So keep the top of your hand over to your palm up. Yeah, so open up the finger under. Now hand and blood stretch. Keep your fingers underneath that. I will give you some love. At the same time, you can pull it over. Keep pulling. Just don't touch this part of the glove. So what you're doing is perfectly sterile. The inside of the sterile. And I'm just touching. You're sterile. So it would be cut like this, and then you can stick your finger here. And pull it down. Yeah. Yeah. Which is great. And I have certain questions, issues. But now you gotta, you're suiting up to go for procedures, this is the exciting part. We used to fight at the doctor's office. I use that term. We would literally fight, I'm not kidding, outside of the door, be like, no, I'm going to this one. Because we had this really cool, like, incision agreement. We had one time that the nurse practitioner forgot to cover the area. She didn't use any sort of shield, and she went down to push on this guy's lower back. She had numbed it, she opened it with the scalpel, she went to push on it, and there were 4 of us in there because we were all so excited to get it. The pus shot up, hit her all over her face, all of her hair, up the ceiling, down, hit every single magazine on the wall, and hit the floor, and we were all like, it was a mess. I mean, she had it everywhere. So, but it is true sterile procedure. Start pulling it over top. Pull with your right hand. Where you have it underneath. Pull it over. Fine. It's part of the practice. So I want you guys to take these home with you in practice. No, not just that was good. See, it's not that it's that difficult of a skill, but it's same concept as quite a few of these skills. It's something that seems really simple, but when you have, when you only have like 45 seconds to take care of this while you're in the room, you want to make sure you practice it so that you feel comfortable. Because you don't want something like this to be an issue. You don't want to hold up the doctor who's getting his patient with you, and then you're getting concerned, frustrated, upset. The patient, you're trying to, practice. Just practice. You'll be glad that you did. It's not challenging. It's something that's simple. It's just a matter of being comfortable doing. And remembering how important it is to keep it in sterile field. If you don't learn anything else in this class, please know about sterile fields, about treating people appropriately, about identifying your patients, about confidentiality. All of these things are huge in the medical field, okay?
Yeah,
I know we
don't
talk.
do it, so if you can give some staff session.
Oh yeah, you can give a mercy, you can give a fetus, all kinds of infections. Because if you're putting on sterile blood, there's a procedure getting ready to happen. It's something that's going to enter that person's body, and they're at risk of infection. They're automatically at risk of anything that's going in their body.
And I learned that because I went to hospital for a tubulization. They couldn't go through my navel. Sent me home, told my husband watch my navel, make sure there's no possible infection, right? We got home. The next day, I'm in excruciating pain, can't figure out why. He looks at my navel, he said, well, there's no cut there. I said, what do you mean there's no cut there? I said, I'm not hurting you. I said, work down below. Then it caught me dagging all the way across my whole while I was running.
Hopefully there was a reason.
And then I was in, I had infected, unexpected. The next day, I had 103 fever.
Oh my God.
So I had to go back and the stitches removed and I had to be back for 8 weeks.
Oh my gosh.
When I was not good.
Yeah. And it's frustrating too. It's something that was unnecessary.
Yeah, because I had a newborn baby. I've been pick her up for 8 weeks. I've been, I had to have people handle things.
You're already emotional anyway, that's you have to do.
Yeah.
It's the best. Yeah, you don't want to have anything additional. Okay, take you home with you. You need some help. Okay, remind me before you leave, I'm gonna give you a larger size, okay? Does anybody need to have a different size to take home?
Very large.
What do you say?
Smaller.
Okay, yours are very large, okay.
Yeah,
I'll see
they
if you've got enough. I gotta make sure we have enough for the class next week too. Okay, so let's talk about blood. Grace, are you okay with talking about blood?
Oh, yeah.
Okay.
It's fine.
Okay, okay. So make sure that we fall out. Okay, positioning. When you are doing a blood draw, how should the patient be positioned? Usually sitting, okay?
Yeah.
Some offices will have a special chair where if they put something down in front of them, that helps if they're a fall risk of someone who might pass out, okay? So usually it'll be a chair, will have some sort of armrest, okay? So best position is for them sitting up straight, they're gonna have to straighten their arm. If you have somebody who says, I pass out or I get dizzy every single time I get my blood drawn, where should you put them?
Lay them down.
Put them on a bed, okay? Find an empty exam room, draw their blood. Take all of your supplies with you, put them laying down, okay? The common reason somebody passes out during blood draw, does anybody know why?
Anxiety.
They vagal down. So the vagal nerve, one of your cranial nerves, they vagal down, which means they hold their breath and it affects their nerve and it drops their blood pressure. And that's out.
And it runs on my house's side family. Him, his sister.
Yeah, because normally people are thinking about it, they're getting anxious, they're looking at it, and they forget to breathe. They literally forget to breathe, they're holding their breath. And it affects their vagal nerve. We had my daughter when she was 4 years old, that happened in an ENT office. She's like looking at it and she's fine, and her eyes roll, and then she drops. The lady freaked out, had no idea what to do, left her in the chair. Oh, she's like leaning over in the chair. I'm holding on to her while I'm holding on to our younger daughter. If you're concerned, lay them down.
Yeah.
That's what I would say. If you're not laying them down, if you have a chair that you can use, that would put something in front of them to protect them. Because if you don't want to happen is have somebody fall and get hurt. Okay.
I had a nurse tell me to breathe. Breathe, honey.
Yeah.
Yeah. Usually they keep it like orange juice or crackers juice.
Yeah, yeah, and that's good, especially if your blood sugar drops. And people that are getting their blood drawn, like to donate blood, they're losing a larger blood volume, and typically that's a blood sugar issue too. But yeah, it will help. Okay, so let's talk about sites for blood draws. Usually inner arm, the bend of the elbow, okay, the antecubital fossa area is what this is called. There are different veins that you can use within the arm. Did you guys see the picture in your chapter about the veins? Okay, so median cubital vein or the cephalic vein, two different veins. What you need to know is you can draw from either one of them, okay? All right, so when you're checking for a good vein, what can you use to put around the arm to help?
Tourniquet.
Tourniquet. Okay, everybody pull out their tourniquets, please.
Grab one too.
Okay. The best way to practice this, I'm gonna let you practice on the arm one by one. You can also practice on your lower leg. That's an easy way to attach it. If that's not comfortable for you to lift your leg up, practice it with somebody else. So this. This. Is that gonna help somebody?
No.
Is that gonna help you find me? Okay. So you want the tourniquet to go 3 inches up around somebody's arm. You're doing the upper arm. So we'll say at least 3 inches or so above the bend of the elbow. When you're pulling the tourniquet, pull it from the base of it here. Okay, that's how you're gonna pull it tight. Either side, pull it tight. Very tight. Okay. Don't have to hurt the patient, but you pull it tight here so that it gets tighter on the other arm. Okay? Cross over like you're making an X. I stick my finger under and pull it like that. I don't care how you do it, as long as you're crossing it over, making an X, and making a loop. You know why you make a loop like this?
So you can pull back.
Correct. So look, once you've gotten that vein, you're almost done drawing the blood, you're gonna pull the tourniquet off. Guess what? It's off. If you loop it like that. So look what happens. What would happen if you exit and pull it? Well, now what? You're done drawing the blood, but you still have the needle in there, and you can undo it. So completely tight. So that is important. It's important to make it like a bunny here. Okay. So pull it tight. You can practice that. Practice pulling it tight. Crossing over, pulling. And get a loop there. Pull it this. Okay, so if you can, I want you to go ahead and practice that. Try it on your ankle. You can lift your leg up. If not, you can try practicing it on. It's a tricky on your forearm because you can't pull it easily. But I want you to practice the concept of tucking it under. You can do it one-handed. It's just not going to be as tight, which is fine. This is another thing we're putting on steroids. It's not that it's a complicated task. It just takes some practice to get used to it, okay? And you'll find what's most comfortable with how you pull your hands. But pulling it tight at the base and not at the outer part is important. Pull it tight, closer to the middle. Yep, and then try pulling. Yep. Done. So pull it tight right behind. Yep. Ready to grab it on either side. Yep. Good. Yep. So look what happens if you do that. So leave it. So we're gonna try it. So put the tourniquet back on for a second. Wherever you have it, I want you to put it back on. Let's talk about the process of finding the vein. What I would recommend you guys do when you're going to draw blood on a patient, you're gonna identify the patient, you're gonna wash your hands, you're gonna have your gloves on. Before you ever get ready to pull the needle, pull the cap off the needle, find that vein. Look at the site to make sure that you have an idea of where you want to draw the blood. Before you ever even use an alcohol swab, put that tourniquet on, look at the site, okay? With gloves on. Gloves on, put tourniquet on, check the site. What should you do after that? Does anybody still have the tourniquet on? Yeah. How's it feeling? Is it getting uncomfortable? Okay. So go ahead and take it off. The point of that is for you to see what it feels like. So if you leave that tourniquet on, you check that site, you say, okay, I like this vein, this is what we're going to go for. And you leave that tourniquet on, and then you go over and you assemble your supplies, and you wipe off that area, and you let it dry. Well, now you're ready to draw 5 tubes of blood. Guess what? They've had a tourniquet on for probably at least 90 seconds, and they're getting uncomfortable. You think they're going to be relaxed when you're drawing the blood, and you're going to keep their arms straight? They're going to start getting anxious, and they're going to get tense, and they're going to feel uncomfortable, and your hands are going to start to get numb. So think about that with timing. You're going in there to draw blood. Identify the patient, wash your hands, put your gloves on. Go ahead and put that tourniquet on and look at the site. Once you find the vein you want to use, take this off. Okay? What I would suggest is leave this off until right before you're ready. Make sure you have the needle there, your tubes there, everything is right there next to you. Okay? Then, once you're ready to take care of it, you're going to go back. Everything's next to you. You're going to put on your tourniquet. Go ahead and clean the site, because it'll only take a few seconds for it to dry. That site dries, and guess what you don't do? You don't palpate and touch it again, because what would happen?
You're affecting.
You're contaminating the site. So if you push it again after you've cleaned it, what do you do? Clean it again. So touch it, palpate it beforehand. If you're unsure if it is a good site and you really do feel like you should touch it and feel it again, you need to rewipe it again. Okay.
Yeah, because there's people, their veins.
Right. So in terms of feeling it, when you have to turn it on, You should feel it bounce back. Do not necessarily pick the vein that is visible, okay? Just because you can see a vein does not mean that that's the right vein to pick. Push it, feel it. If it is bouncy and you can feel that bounce back, that is a vein, that is a good spot. Add a bonus if you can see, visualize it too, okay? Know that you're going for those spots, those 2 spots in the arm. You want to be able to feel it. When you put a tourniquet on somebody, I want you to practice at home. Put a tourniquet on somebody's arm and feel those spots. See what it feels like. This is, I would describe this as the concept of you're blind. Close your eyes and use your fingers to touch rather than looking at it, okay? Which is you can see nothing, tourniquet's on, you feel this one, you can feel this area, which one feels better? Go with that, okay? If you have concerns and want to feel it again, please rewrite this thing. So, this guy's having concerns on the entire time. You can see uncomfortable? Okay, so, take it off. If you're not ready to do something, take it off. Don't make the patient comfortable. It's just like a blood pressure cuff. You wouldn't pump it up and leave it completely pumped, would you? No, because they're going to get uncomfortable. So, tourniquet. This is the most common. This is considered disposable. You should dispose this after every use. Some offices will recommend that you use a very, very strong sanitizing wipe and use it if it is not soiled. Okay, so check with your office as to how they want you to handle tourniquets. Other option, if you have an elderly person who has very fragile skin, if you're afraid of skin tears, you can use a blood pressure cuff. You can actually pump it up to about 40, and that can be used as a tourniquet. Okay. Other option, they make it hot. Everybody comfortable? Okay. Other options, right here, you've got one that is Velcro. Okay. You put it around the patient's arm. This is a type of tourniquet that you would see if somebody goes to an infusion center often for like chemo treatment. They may have their own tourniquet that's left there. This is a little more gentle than that. Okay. Another option here. Same type of thing. Just clip. Okay. Just put it around the arm. Neither of these are common in an office setting, but I just want you to see them. Okay. You click it on like a seatbelt and then you tighten it. Kind of looks like a car seat strap. Okay. But same thing holds true. Don't be when you get uncomfortable. All right, so let's go through your procedure list, and we're going to talk about your 2 different types of draws that are most common. One thing that will be important for you guys to know in the chapter, I'm not concerned about doing it right now, but moving forward and towards later in the semester, the order of draw for Tues is actually quite important. You have to know that. It's not, well, I'll share some acronyms with you, but that's one of the things you just need to memorize, because the order of how you draw Tues can be important for certain tests, okay? Other thing to know, if you need to invert the tube, which we'll talk about later in the chapter, later in the semester in the same chapter, this is not an appropriate way to shake the tube. Okay, we are not shaking it. Invert. That means up, down, gentle up, down, because you could actually cause hemolysis or the breaking up of those red blood cells. Okay, so invert. Normally they'll say 8 to 10 times. 1, 2, 3, 4, 5, 6, 7, 8. Okay. All right. So let's go ahead and get out your supplies. What I want you to get is your needle, your vacuum cleaner, also your butterfly needle, at least 1 tube, test tube, your glove, alcohol swab, gauze. Somebody check for me. Do you have any sort of paper tape in here?
Yes.
Yeah. don't have tape. Does everybody have gauze? Yes, pull the butterfly out, see where my supposed to go. And then pull out your arm from that box. So you have all that stuff at the end of the point for now. Also pull out your smiley face. Please go. So here's the rule. If you are practicing a blood draw, okay. If you're practicing a blood draw and you're in between doing something, these needles have safety. If you push the safety onto the needle, you're not going to be able to use this one anymore. So for our purposes, I want you to keep practicing with this one today. I don't want you to put the safety as soon as you do it one time. I want you to practice. So if you're in between doing things, I want you to stick that needle with an active band. I want you to poke it into your time, okay? So that nobody gets poked with that needle. Okay. Now, when you're in the office environment, this is good to know. After you've drawn somebody's blood, this is how you protect yourself from the needle stick. You click this safety, and it will click into place over top of that needle, okay? Then you would discard it and push it. Okay, you're missing your squeeze ball. Who else has anything to say?
I think I have what I need.
You need tape, okay. Bring your arm today, right? I'll get you one.
Good night.
Yeah, those good.
We're using the ring needle, right?
Yes, and also plug your butterfly. That's fine. Yeah, any test tube is fine. We're not worried about the color right now. So everybody
You need this
have- yes. Okay, who has their procedure list up?
I think
Okay, I want somebody to read it to me step by step. Let's go. 1, 2, 3. We're all gonna do it together, okay? Yeah. Okay, so what's number 1?
identify the patient by using 2 identifiers.
Okay, what are 2 identifiers we can use? Name and date of birth. Okay. Hi. How are you doing today? Can you tell me your name and date of birth? Okay. Verify that. What's next?
Symbol needed labels on a flat stable surface next to the patient. For needle assembly, secure a safety needle onto the container holder by screwing the grooved end of the needle into the grooved tip of the adapter. Hold the needle guard and turn the adapter in a clockwise motion. Step aside, wash hands, put on gloves.
Okay, so that was a lot of words. Grab your vacuum. Grab this little plastic thing. These 2 are married. You cannot use one without the other, okay? So I want you to grab the white part, the white bottom part, white cap. Yeah. Okay, grab the white cap, pull it off. Go ahead and look at this. It looks like what? Look like rubber? Check this out. It's a needle. What is this? Don't pull it down. No, no. Other side. The white cap. See that the needle? So the idea of this, concept is that you guys are so privileged that you don't have to draw the blood and transport it into a test tube, okay? You like that privilege? No, this is really cool. No. So put it down. No. Put it down. Cap it. No. Yeah, we don't want to hit the safety yet. There you go. Cap it. Pull the other part. So this is really cool. Gray part goes into the top part of this vacuum chamber, the top part of the plastic. Okay? Now we're married. Twist them together. Okay. So guess what? This is what you're using to draw blood. When you pull this green cap off, that is a needle that's inserting into the patient's arms. Your test tube, once you have inserted the needle to the patient's arm, is going to be popped into here. It actually pushes down. That needle that's inside of that rubber looking area pokes this, and now it's vacuum sealed, just like how the vacuum seal containers that we drew out from before. It's the same thing. The blood is going to rush into the tube. So you're not having to draw up blood in a syringe, switch that needle, poke one of these bottles, and push the blood in. That's what we used to have to do before they created these awesome things. So these two pieces, you cannot go and draw blood with only this piece. Okay, you need to have a vacuum. You need to have a pus. So what's next on the list? Somebody else read. Is it our number 3?
After consulted patients, selective vein that can be palpitated.
Okay, so put this down. Everybody have their arm out. If you don't have your arm out, go ahead and read that out. Your practice arm, I'm sorry. Not your real arm.
Hold on.
Just be careful with these, because sometimes the liquid does leak. You may have to check it and make sure everything's
I don't have no liquid in mine at all.
okay, here, sorry.
It's okay.
Okay, so I want you to practice trying to put the tourniquet on this arm. Okay, so just practice the concept of tying the tourniquet around this practice arm. The other cool thing about these two, I was using it on my husband last night, showing my daughters. This Velcro part, you can actually strap around somebody's arm. So you can practice. You have to practice it before. I mean, you can't actually get it on an elbow easily. But practice the concept, practice positioning somebody so that it's very realistic. Okay, so practice putting the tourniquet on. And what are we supposed to be doing? Checking for a vein, right?
Name, paper.
So apply a tourniquet to the patient's upper arm, about 3 inches above the bend of the elbow. It's hard to do on a contract. We'll always practice it and do it later. Okay, so I want you to feel around. Feel that arm, that pretend arm, feel for the veins. Decide on which one that you would want to pick. To draw from. Another rule for you to know too, 2 sticks and you're done. Okay, in any setting. If you try twice on a patient and you have not drawn their blood, somebody else needs to draw their blood. Okay, do not do more than 2 times. Other absolute no, do not fish the needle around. Ever, never, ever, ever. Because you're going to be poking in and out of that vein. The chances are they're going to have a nasty looking arm when they leave that office the next day when they wake up, and they're not going to be happy, and somebody's going to be hearing about it. Okay, no fishing, no sticks more than twice. Okay.
I like people do that though. They'll go in my vein and they'll move that needle all around.
It's
It's
not-
like,
it's
great.
not good. Yeah.
That works.
It does, because it should be done. Okay, so you've got your tourniquet on. Have you picked your vein? Which one do you think you want to do? Go ahead and pull that tourniquet off. And I want you to, we're going to pretend we're washing our hands, I want you to put your gloves on. Anybody excited? This is fun. Okay, so what is the next step? Number 5, clean the site with alcohol brush. So go ahead and grab your cloth, and I want you to clean that spot that you want to use. Start in the middle, circular motions out. Okay, go ahead and while that's drying, go ahead and put your tourniquet back on. I want you to practice taking it off and taking it off. What I would recommend is putting tourniquet on and then leaving with a real patient. I want you to keep practicing that time. So Site is clean, tourniquet going back on. Tourniquet should go above where you're drawing. Tourniquet goes above the draw site, about 3 inches. You'll have to modify with that size of an arm. So number 6 says, ask the patient to clench the fist only if the vein does not stand out. So that means not every patient needs to be squeezing their hand like this. That's if it's not visible and you're not feeling completely confident that you can feel that elasticity, that bouncing of that thing, okay? All right, what's next? Number 7, take off the needle guard with the bevel of the needle up. Pull the cap off, green cap off of your needle. I want you to look at it. Do you see the hole in the tip of the needle? You should always see that hole in the tip. It should be facing up, that is bevel up, okay? So that means do not try to poke them this way with the hole down. Pull up. The safety, they've also placed it in the perfect position, so it's going to be really hard for you to try to draw it upside down. Okay? So, what's next?
You got put your,
Take off the needle guard with the bevel of the needle up. Insert the tip of the needle into the vein with a quick and steady motion, following the path of the vein approximately 15 to 30 degree angle. 15 to 30 degrees is not a very high angle, okay? So that means you should be going pretty close to flush with the skin. That's good to know too, because you'll see a lot of people that are jabbing in with the wrong angle. Okay, part of inserting the needle that I want you to know. I'll put this on so you guys get a real look. When you are, put the tourniquet on, you clean the site. When you are inserting this needle, you want to use your non-dominant hand to pull the skin taut. Okay, so that means hold the skin down. Part of what this is going to do is hold that vein in place so it's less likely to roll. Okay, so you're pulling the skin down. Now you're going to insert the needle above where your thumb is. Okay, not below, above. So when you're inserting, 15 to 30 degree angle. Does the needle need to go all the way in so you can't see the needle? Absolutely not. You only need a very tiny amount of the needle to go in. Pull the skin taut, insert the needle. You will feel the difference once you've gone into the vein, okay? Once it's in, the thing that stinks about the vacuum chamber is that you cannot see the blood draw back. So you need to feel confident you're in the vein. Once you're in, you need to hold on to the base, grab your tubes. Okay. So do you see what happened? You see how I pulled the needle out a little bit? You have to be very careful about how you pull that in. See how blood's going in? This guy doesn't have enough pressure in this thing, so you get a little bit of blood. So you need to hold down the vacuum chamber. I don't care how you do it as long as you don't have your hand up here. Why? Because your risk of getting poked. So you need to insert full skin taut, insert 15 to 30 degree angle. Once you can tell us you're in the vein, that's far enough. I can already tell them I'm in. I didn't push them in very far, okay? Because chances are if you push too far, you're going to go through the vein to the other side. And it's going to be really difficult. Once it's in, you need to hold on to the vacuum chamber with one hand. I don't care which one you're more comfortable with as long as your hand is not up here. For me, I like to hold like this. You hold in one thumb against the skin, one finger is up here. You hold onto your tube, and this is where you need to be careful because if you jab this in, the needle's going to go on the patient's arm more. Hold this tight. Pull against it. See here? Fingers on either side of the vacuum cleaner. Push the tube in. It almost sounds like a clicking sound. To be able to see the blood going into the tube. If the blood is not going into the tube, you're not safe. Okay? This is not a good time to fish around because this is vacuum sealed. And if you fish around with nothing in the vein, it's going to be painful. It starts vacuum. Pressurizing and pulling that blood into the tube. Okay? So let's say you have more than one tube to draw. You continue to hold on the base of that container. You can invert them or wait till the end. Grab your next tube, in the correct order. See, like a peace sign, fingers on either side, push it in. Okay. If this is your last tube, while it's filling, go ahead and pull the tourniquet. Okay. Pull the tourniquet off. Last tube is done. I made this mistake the first time I threw elementary school. I pulled the whole thing out at the same time. Don't do that. You know why? Because it's vacuum sealed and it's extremely painful. I was like a bodybuilder and I thought I was going to cry like a baby. It was awful. Okay, so don't do that. You get to learn from my mistake. Pull the tubes out first. Starting on now. Pull the tubes out first. Then, with your gauze, you would pull the needle out, put down pressure. Flip your safety. Okay? For us today, we're going to keep pressure. So don't push the safety. You cannot undo the safety. Hold pressure. Once you're ready to put this and discard it, ask the patient to hold pressure on the site. Now, it's completely up to you and how your office policy is. Sometimes places will suggest that you take a piece of 4x4 gauze, fold it in half again, switch it out, get on a piece of tape. Okay? Paper tape, like what you guys have, is awesome because it's not as sticky and skin, it's not as easy for them. Some places will do Band-Aids. But it's really important that either you hold pressure or you tell the patient to hold pressure because the blood will pool in that spot because you just poked the vein and they will get a bruise if they're not holding pressure well. Okay, it needs to clot. So to hold pressure, they need to hold it for at least 2 minutes after. If you walk away, tell them to hold it. Okay, and that's it. Go ahead.
Can you repeat to take the vacuum seal part off first or the
Tubes out first. All the tubes out. So your tourniquet should go above. Your tourniquet needs to go above where you're drawing blood.
okay.
Yeah, so it's like if you're drawing blood here, the tourniquet would go up here.
Okay.
It's confusing on the phone.
Yeah.
Because there's not much space. I just need to practice the concept. So yes, let's go over it together now, okay? So, what have we done? We've identified the patient, we washed your hands, put on our gloves, we checked for the vein. What's next? Put the tourniquet tight. Go ahead and grab your vacuum cleaner with the needle. You pick the side of your vein, which means your non-dominant hand hold the skin taut or tight. Okay, and then go ahead and insert your needle at 15 to 30 degree angle. That is about like this, okay? Not high. And watch your fingers. Keep your left hand away. So your fingers will use your thumb to pull down. So then all those fingers are out of the way and more safe. Keep your hand, your non-dominant hand pulling the skin up so that vein does not roll. Okay? When you're first inserting. Hold the skin up, insert the needle. Once you're confident that you're in the right spot, hold on to the vacuum container and insert one of those tubes. Yeah, and it won't fill up completely. The gravity working against us here. So I want you to practice holding on to hold on to the vacuum container. This is a really good time for you to look at and think about how you would feel when you're transferring those tubes in and out. How would you feel if that needle's going in and out of your arm? So it's a good opportunity for you to practice. How do you feel most confident holding that vacuum container steady? Just do not stick your hands above where the needle is, okay? So you hold it steady, poke it in the test tube. And then once you're done practicing, make sure that tourniquet is off, grab your gauze, put your gauze in your hand before you ever take the needle out. So it's literally split second, needle out, push on. As soon as that needle is safely away from you and the patient, you're putting pressure on the site with the gauze. You okay?
Yeah.
Okay. If anybody starts feeling sick or dizzy or needs a break, please step out. It's good exposure to needles too for those people that are frightened of them. You can see them up close and you realize that not straight. Don't watch your ankle.
I'm not getting any.
Lower.
Okay, I was wondering, no, I didn't.
Perfect. You don't have to go all the way in. But once you have
Okay, thank you.
Should start flow through there. Your plans are. Have one here. No.
This one here.
So look at your ink. Yeah, that's right. Okay. Perfect. So it should start.
Yeah, it's going.
Are you okay? Okay. If you need to go to the right. All right. You got something about your party? Yeah, not too low, not too low. Not too busy.
Show me again.
Yeah.
I will just, yeah.
Pull it again.
Yeah. I'll do that.
Anybody start feeling dizzy, queasy, if needles are not your thing, please get out of the hot and steamy sweaty room and look at your okay, please. You don't have that permission. I don't mind it. Oh, right out.
I'm gonna try this. We're gonna keep it.
No, we're not. Are you okay?
Yeah.
Okay.
All right.
Go ahead.
Oh, no, I think I got time.
All right, you might have questions,
All right.
concerns, we're gonna do it with them.
I didn't take you to that.
Okay. It's part of
I
it.
wasn't getting
I made it
lawyer. Yeah.
It's
So,
yeah,
like, yeah, go down and then you can
if you're not serious.
So like here, or would you go here? Either place, I didn't go there. Yeah. So
Okay.
you probably will.
I was making sure. I don't want you to go.
I just didn't get the blood.
I think that's.
It's not perfect. It's not perfect. It's up.
Okay. My big old
Yeah. There's a lot of fun.
Oh, okay, yeah.
All right, try again.
Ready? So I'm gonna.
Does anybody still have a tourniquet on their patient?
No.
Is their arm blue yet?
Maybe you don't have enough.
Sorry,
I know.
Okay.
You must have a different. I don't know. It's just not.
Oh, okay.
I did see it. Because when I like. We do also because it's not enough. I don't think. Like when you push it, you'll see it move. Right. Which way does it go in? There's no. Oh, this one is. Oh.
That's okay. That's all right.
Okay.
We've got our two. Just practicing the concept of
All right.
inserting to.
That's embarrassing. I was
After
fold
you do
it.
it one time, you'll do it. So I'm gonna give you guys until 11, a little over 15 minutes. I want you to just keep practicing this. I'm gonna walk around and look at it, help you walk through it together. And then once we hit 11, we're gonna go over the butterfly needle method, okay? We doing okay?
Yeah. Here, it needs to be here. And then my thing wasn't unclamped, so.
Yeah.
Yeah.
You may need some more blood too. Oh, there it is. This is unclean. Making too much out of this spot. It's part of the problem. There's some more volume. Okay, try now. You've got some red there, and we can refill it. Just remind me before you leave. That's fine. Okay, that's okay. So there's not a whole lot of blood in the back because I don't want it to explode in your car. It's part of the reason. But it's not going to be completely full because the part isn't pumping. It's not going to push into there. All right. Cool down right. Your thumb. Yep, you're right-handed. Mm-hmm. Yep. Do you feel a difference? Mm-hmm. Yep. There you go. Yep. Just squeeze. Yeah. Like it's pumping. Yeah. When you switch from pulling your needle out to putting your gauze on, that needle needs to be completely removed. Do not put the gauze. But I don't want to see you do, and you didn't. I'm not going to fault you at all here. What I don't want to see you do is this, as you're pulling it out, because you're risking getting hurt. Okay, so your hand should be close with the gauze. Do not put it on the needle. Don't even get it close to the needle. I want you guys to be protected. Okay. All right. Let me get you a smile, please, real quick. So you can poke it under. Well, the last week or 2 weeks ago, it's the only time you have to
Yeah, so I'm not. But I would be messing up too much. No, I just hurt the person. I need that.
All right, so I'm gonna set up arms. One or two come up and bring forward needle with you. I want you to practice somewhere here. Okay? So bring your tourniquet, your needle, and your supporting testers. And hang tight for a second. Grab that stuff on your legs down first. Anybody have any questions? Okay, just keep practicing. I want you to again and again and again. So I can come around and watch you. This concept is totally hard. It's so cool. We didn't even have anything like this when I was in nursing school, and I wish that we could like go back and be able to practice. We had one arm like this in the lab. We would all fight with it. So you get like 2 minutes with it each time you go to school. So then to be able to go home and practice like in the comfort of your own home when it's quiet again and again and again.
Did you have to practice on oranges and stuff?
We did. We had arms in the lab, but it's kind of underwhelming. This was also more than 10 years ago now. So it's just technology has improved so much. I don't want to be my age. Okay, that holds right. Just not gonna hold you back. Okay. All yours. Come around and watch you guys. If you need help, please tell me. That's what I'm here for. How are you? How are you? Good. Hey guys, how's it going? Okay. Okay. Thank you. I'll be right back.
It did it first.
Yeah.
Did you ever get it?
Yeah. I did.
I'm not getting it.
But if you've already used it before.
I tried twice.
Okay.
All right, I looked at it. Very nice. This is gonna.
Oh, that's okay.
Oh, look at you. Okay. All right, I can do that. Thinking like I can do this. I can do it.
No, it's just, what we really is like a little ice bowl that holds up high.
Yeah.
We have one.
Oh, I'll be
But
good.
it's like it's like a steamer. Oh. I got it.
Wow.
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 Yeah. Okay. If somebody else wants to go up. You have questions? Okay, do you want to come up and practice?
Yeah.
Okay, bring your stuff really like yeah, lay it down. Bring your vacuum cleaner, your needle, your tourniquet. There's your needle count. Okay. So again, I know you did that once here. Please don't break out needles when you're in the clinical setting. This is just for us practicing, okay? You're gonna have the safety on, that's what it should, you should be using, it's but not safe, put it in the chart. Petty, yeah, oh, yeah. Okay, and I just show them your classroom. Yeah. We won't invade space. But this is the other. We love space invaders. Right? And they, this is our CPT class, or not CPT, CCMA for medical assistant. So this is what you guys are taking this semester, right? This next semester. Awesome. Allison will probably potentially be your teacher. So, well, she's like, really? Yeah. You're gonna help at least. How is everybody? Good. Good. I love seeing you guys.
Yeah, this is our last day in person.
Isn't that crazy? That's really insane. How's online? Does everybody like it? Mixed. Mixed. Yeah. Okay. But I think there's a learning curve on our part too. Yeah. Well, we're all learning, trying to figure this out. It's quite entertaining in high school too.
Oh, I bet.
Yeah.
I'll be right.
Yeah.
See, that's what I. So now we release this. It's awkward. That's why it'd be nice to put this into the article to practice this, so then you click on the political service. That's why you don't want to pull it out. Exactly. I'm glad. Yeah. You gotta show me. Yeah, this is good on the ground down. Try that. Okay. I like to tell you all the areas I'm used to. You don't think them. Yeah. Go ahead. Yeah. Right here. Yes. Another thing I want you guys to do too is feel this arm up here. I want you to twist it around and feel the difference. Okay. Tell where the vein is and where the vein is not. Oh no. Go ahead. Okay. So things to remember, tourniquet, 2 or 3 inches above that crease in the elbow, okay? Because you don't want to run into the issue of your needles getting too close to your tourniquet. Okay, so tourniquet 2 or 3 inches above. And always be mindful of how long the tourniquet has been. So make sure you all should yeah. So you attach before you ever start the procedure, about attaching the needle to the vacuum container, okay? With gloves on, please. Needle to the vacuum container. So then when you're ready to actually draw the blood, all you have to do with that whole contraction is just pull the cap off the needle. You don't have to mess with attach anything after the tourniquet's on. Okay. So holding down pressure with that bottom after you take the needle out, it is not gentle. You need to put a significant amount of pressure on, because that's when you're going to avoid them getting nasty looking grooves. Okay. Obviously, if they're old and frail, please don't bruise them by putting the pressure on. Be mindful of their age and their size, but you do need to put firm pressure.
No. Maybe want to try it.
Right.
Let's go ahead, hang tight for just a minute. I'm gonna show you guys the butterfly needle method. And so then you guys that aren't up here practicing with the vac container can practice your butterfly needle. Okay? You practicing both. This is not the type of skill where I want you to do it one time and just put it away. I want you to keep doing it today. And I want you to practice this often throughout the rest of the semester. Anytime you get a chance. Because most offices expect you to come in with the concept of how to draw blood, also the ability of doing it. Because even if your office has a lab within the building, what if she's out at lunch? What if she's on vacation? They're going to be relying on you to be able to draw blood. So I want you to be really comfortable with this skill. This is a really important skill. Okay, so let's talk about the butterfly needle. Best time to use the butterfly needle is kids and elderly. Those are the most common times. Butterfly needle can go into the antecubital space, but it can also go on top of the hand. So if you have those little old ladies that's really hard to draw the blood, you can use the top of their hand with the butterfly needle. So everybody look at their container that has a butterfly needle in it. What do you notice about the sides of the needle? Yeah, the size and gauge, so it's shorter, and the gauge, the opening of it is much smaller. Which means if you have quite a few vials to draw, it's going to take longer because it isn't as large or as open as a needle. So you have to think about that too and think about how long that tourniquet is on. Okay, so let's go ahead, clear your space off, move your other needle out of the way so that you don't press your needle. We're going to go through this process. Same exact thing, but this time we're going to use the butterfly needle. We're going to figure out how to hold it differently. Okay? We're going to use the hand. You guys need to use your arm. So, identify the patient, same thing. So identify the patient, and I wash your hands and put our gloves on. Let's go ahead and look for a site. So put your tourniquet on. Okay, check your site, feel for it, decide if that's the one. If that's the right one, go ahead and pull your tourniquet off. Okay, now you're going to gather all your supplies. What do you need? Butterfly needle, gauze, alcohol swab, tape. Tourniquet's already there in whatever vials. Okay. So once you have everything together, let's go ahead and tourniquet back on. Once your tourniquet's on, go ahead and clean the site. Friction, start in the middle, circular motion out.
Should we document at home when we do it? How many times?
It's not necessary, but if you want to, sure. So we're on the site dry. We're not waving our hand over it. We're not blowing on it with our mouth. Okay. Go ahead and open up your butterfly container. All right. What do you notice about this? You see that gray rubber tip? So that's what we need to do. We need to detach it from another needle. That's why your needle is in your silent face. Lift it up here. Lift off the back container from your other needle. Unscrew it. Okay. Go ahead and attach that back container to the butterfly needle. Get the plastic wrap off from around it. Attach to that container. This is something that you would want to do before you clean the site, before you put the tourniquet on, okay? Because our seconds are ticking down. She's had it on for a long time. Little Edna over here is not happy with me because she's in pain. Okay, so what's next? Site's clean, tourniquet's on, ready to draw. So pull off your cap, straight up. find the bevel, find the opening. All right, now you're gonna grab the little butterfly wings, okay? That's how you're going to hold on to it. You're going to hold it just like this, like it's literally flapping its butterfly, okay?
The opening goes up top, right?
Yeah, bevel up. The opening should be, the point should be facing forward and the opening should be up. So same exact procedure. You're gonna hold the skin taut because you're gonna hold that vein so it doesn't roll. Insert same exact angle, okay? And you don't have to go very far. Now, the really cool thing about this, you can basically push it down flush with the skin. Do you hear what I'm doing? If you're more comfortable, hold it with the other hand. The other back is going to be the same process. But what's really cool about butterfly needles is that you will see a flashback of blood in that yellow part right there on the needle. If you hit the vein, you will see that blood before you ever put it back. A lot of people favor the butterfly needle because it's easier. You're confident as you hit the vein. Problem is they're very expensive. So these are to be saved on your patients that are with full blood draws. So go ahead and push your tube in. Okay. Let's say this is your last tube that you're drawing. So this is when it's filling up. This is when you pull your turn off. Okay. Your turn to come off. Nice thing about this too is if you've got a table right here, you can actually set this down if you wanted to while you're transitioning to your next tube. If not, that was your last tube. Turn it off. Finish with your tube. Same exact thing here. Take the gauze. You can hold that yellow base. If you want to grab the wings again, that's fine. It's not necessary. Pull needle out, gauze on. Now, I don't want you to pull it right now because this does have a safety. This will, do you see how I'm pulling it right up right now? You pull this directly up and cover over it and flip. Right? So if you're drawing somebody's blood with the butterfly needle, when you're done and you have the gauze right here, this is when the holding pressure, this is when you would flip the safety on whatever needle you have. Protect yourself, give the needle away. Once the safety is engaged, put it in the sharps. This whole thing will go in the sharps. You can keep the back container part and put it in the trash can. There's no blood on it, but this is disposable. You should not be using the back container part on each patient. Okay. Some offices try to get around spending too much money on supplies, and so they have a little more lax policies on what's used for how long. But in terms of our training here, this whole thing is discarded. Okay. All right, so practice with your butterfly needles. You guys did. I'll like so if you want to see, I'm gonna go ahead and engage this one. See if you hear it click. It's really hard to hear. Let's see, it's completely covered now.
If you look on the butterfly needle, there's words on or letters on one side,
yeah,
and not on the other. So use the one on the hold it up. I mean that could be a
put the letters together.
Yeah.
Yeah. So 23 gauge, but it says on the right side of the butterfly needle. Much smaller than what you'd be using on an older or a less fragile patient. All right, I'll be right back. I'm going to go discard this.
What is it? Oh, my God. It seems like.
Okay. I'll help you. If you want to go ahead and bring up, what I would do is bring up with the butterfly needle. The butterfly needle is the same way with the other needle. Choke it directly into the smile. Okay, don't leave any needle out if you're not using it. Bring both up so you can practice. Okay, fine.
Yeah. I just don't know what I'm doing wrong, because we actually showed them several.
Okay.
I don't know if I don't have any of them.
Well, and I was squeezing. That was part of the.
Yeah.
It's just that you have to be part of the issue. It's not a perfect setup, but it's a perfectly related.
We have to use orange. It's either gonna be orange. Color is good.
Just know if you're in a setting where you're ready to draw blood, make sure that you have both of these parts, okay? Whether it's a butterfly needle or a straight needle like this, make sure you have your back container. Because you don't want to get in there. Communications are not how you're not going to realize that you only have this needle. And what is it going to attach to? Nothing. You have to have this piece.
Once these butterflies, butterflies are.
That's okay. Yeah, don't pull a safety on it if you want to keep practicing. And what I would say honestly is probably best if you just practice butterfly needle here and take on more of the straight needle. The butterfly needle is a lot harder to keep safe. You can't have it. So I would just start those in sharps, other sharps. Is there anybody like to take on a couple more test tubes and practice them?
I was gonna ask you, is this one not safe?
Yeah, if you're not gonna get that pressure, draw back into it again. After you
Okay.
poke it one time. Once you break the seal.
Because it won't stay in the time.
Yeah. It's like that thing you hear when you're in your 20s. Once you break the seal. Okay. Anybody get that? So once you break the seal, you're not gonna hesitate. Did you like my joke? I'm full of funny. Actually, my husband, he doesn't always appreciate that. Hold your weight together. Push them together. Watch that table. If you want, you can shove over there so you're farther away. All right, so let's do that. So your angle and your down to change your one. So you're almost completely flush with the skin. I want you to look up just yes. Yeah. Yeah.
We hold it up.
You see the drawback already? So, did you guys notice how slow the blood goes into the tube?
Yeah.
Obviously, it's a relocation, it's gonna be a little bit faster, but it's much slower than you would have with the straight needle.
So then on this point, you're done, say, next up, I told you, that you won't be doing more.
Yeah, I would take that out. So do not put your fingers that close, like that way just a little bit more here. Yeah, perfect. Good job. You got it. It's an angle. It's just practicing that angle. You got it. Come over here. Yeah. So that it feels more like a patient. Okay. So that you're, surprised. Okay. Yeah. So now this is the patient blood. Okay. Is anybody getting too hot? Yeah, I mean, I feel a little warm. Then I'm growing. Yeah. It's chilling this morning. That's right, 62 in here. Yeah, we got it up to 70. I'm trying to turn on, or not turning, we don't have to, we don't have to stuff down here. So we're just using the one stove. It's okay, but when you go to the bathroom, it's a little bit cold. Yeah, it's gotten cool in the morning. How that comes to you. Yes. Yeah, we haven't split the stove off. Yeah, that was so. When we first got married, living in the house, and I only was we had baseboard heaters, but we realized only the stove, and it was. It'd be like 85 degrees in the house. I'm like, I got the fire. We're already like when it came up, it's 20 degrees outside your cooking doors. You know, and then so. Yeah, you got it. Just hold it, make sure you're holding on to that. One skin, help skin not puncture the skin. One on to the back. With one, so no matter which one. So that you're holding it down, so transitioning and switching the shoes. Okay. Did you try the black one? No. Yeah, try that one too. Okay, did I have something to watch in the third step? Okay, yeah. It is, that's good. Yep, so if you pull it, just make sure it's free. So make sure it's, but yes, how you check the numbers. This is where you're doing great. That's good. I put just a tiny bit. Can you tell? Yeah, take it out. And how much could go for here? Just like you're inserting it. And almost. Yep. Push it. Okay, now try it. Just don't worry about the technique. Just try to open it. Okay, so that's what you want to feel. Once you feel like it's really going in, you don't need to stop. Because you risk pushing beyond the other wall. That's good for everybody to practice too. Practice cooking. What's wrong? Oh, you're not.
I don't do the spiders, you know why? I have bit. Spider at work one week.
One thing that's good to practice on these arms, try poking either of those needles into just the skin area. Feel the difference between poking into the skin versus poking into the needle. Don't even worry about pulling the skin taut. You can just feel the difference. Skin versus vein.
I have a question.
Oh yeah, hold on one second. Oh, that's okay. Here, let me squeeze it. Try again. Time. This is also a good chance for you guys to practice with IV tubing. Usually in an office setting, you really don't see a whole lot of IVs being set up, but sometimes you'll have a fairly healthy adult who's dehydrated and the provider wants to give them a bag of fluids just so they don't need to go to the ER. So it's good to mess with the student and feel how you would type. That's what these are. So always be mindful of these butterfly needles of how long it takes to fill the tube. So a lot longer than the straight. So it's really important not to put the turns on until right before you're ready to draw. Or what was your question?
What if we had a small vein?
So that's fine, as long as you're getting the blood in. If all of a sudden you're in a tube and you can't fill that tube up right into the blood and you have multiple left, you're gonna have to take it out and that's when you'll see a lot of people start pushing around because they're saying, right in the vein, I don't want to pull it out when you want in.
So like there's like, compare the two, that we should pull, how to think of one here. That's what more needs there.
Yeah, so that's why we want to feel residency. Because if you're feeling, you're looking for those deeper, those two are the deeper things. The ones that you can see, sometimes they're super simple, the ones that are humble that you're not gonna get the blood. That's a really good question.
These are points from here. So that's down.
Yep. Yep, and you can feel the difference when it's open, it'll move up and down. And yep, that's what I do. And in your IV bag that you have, so if you look at the side, you're in the office and a nurse or provider is adding an edge to the bag. This is where they would inject it. So this extra little flap here, but actually be cleaned off just like we would with a vial. We're going to inject the medication into the bag.
See how
We're doing great. Okay, who wants to come up to the arm next? Can you come up here? Yeah, let me wait.
never would have guessed.
Constant travel.
What's that?
It's your front of my car.
Oh, they got the good ones.
Yeah.
Okay.
What'd you say?
Have to avoid this part.
It's a full body one.
So what?
I have to run in back.
It does not make it slow down.
I have to practice a lot.
That's well, a lot of places. The office that I worked at, we had a lot of in-house. So the majority of the time we were drawing blood. But
It's good to know.
yeah, there were plenty of times when she wasn't available. She was out of town. She was gone on her knees.
I know an RA is a long time.
What?
Yeah, she won't even get shot.
She won't get shot. That's interesting.
She freaks out. Something.
Yeah.
You know.
So once you got to this point, you don't have to fight like that. You just hold the finger right here. Okay, and it's not
I can make some noises. Really.
I found smiley face sleep well. That's the only time somebody's gonna smile at you when you're poking them with needles.
Well, what I do, because I don't like needles, is I say I have great veins. You have one shot. Do it right. And then I lay down and close my eyes. Really? If they want me to sit down, I say, I'm not sitting down. I'm laying down. I'm going to look the other way. And we're going to talk while this is going on. And I'm fine, but don't screw it up. So, does that help?
No
Does that make
pressure.
it better?
That's what I told her. I could take a walk in confidence.
Yes,
For the patients like you.
absolutely. Absolutely. You got to look like this is a piece of cake, and if you have problems with needles and blood, don't worry about it, because I'm here to knock it off. So yeah.
Did you try to straighten them?
Don't ever say I can't find the vein.
Other way. Yeah.
So phlebotomy was not.
Yeah, we got a whole class. On phlebotomy.
I might have to think about it, just so I can do it.
They have all kinds of therapies that feel like exposure sometimes will help you get over phobias. So, for those of you that don't like needles, welcome to
Yeah.
exposure class.
I'm just not hitting the.
Yeah, let me see that.
Yeah, well, they're in- see, this is what-
She's like, no.
Mine was.
I know.
Somewhere.
I've seen this party.
Yeah.
Okay. I'm gonna be covered. They're gonna be, film something. Go home, they're gonna worry about it. All right, that's true. I'm gonna have to have like. Puppy pad. Oh, like a big part.
Let me go grab, I'm gonna grab some extra tubes for you guys. Does anybody have a question right now?
Oh,
Question, sure.
so going over the blood pressure
Yeah.
and the EKG, that is one more to. Those do, yeah.
Staying after both because I want to put stickers on if you want a mannequin.
Okay.
Robin has some high school students and they're in our lab right now. So once everybody's packed up and hang out to have a few minutes to stay.
Oh, yeah.
Yeah.
Because I'm gonna set up with this too.
Yeah, and then bring out, Lucy, you stay after you want to move over these together. So anybody else want to cease engaged? Are you comfortable with how the learning path looks? Just remember, email me, call me, text me. I'm here. If you have a question, I'm here to answer it. I can't promise you I will always answer on the first call if there's total chaos right now in the house. But I will get back to you ASAP. Yes,
So I still can go back and do some of the quizzes.
I have to see if I can reopen it for you. If not, I'll have you just reach out.
Already did.
And that's fine.
You already read the chapter one.
But I want to show you what it should look like. And I'll blow it up on the TV so that you can see it.
So we're supposed to have like on lecture notes, but there's supposed to be lecture notes on the computer itself, rather than doing it.
That's what do the lecture notes look like? Is it like the PowerPoint that I showed on the pre-recorded lecture? I'm not completely sure what. I'll have to. Okay. Okay, I will look at it. I don't have an answer, but I'll reach out. Got it? Yeah. And you know what? That's exactly what I'm practicing. If you guys practice the technique on the arms, that's the biggest part, is feeling comfortable with where you put your hands, how you manipulate things, what goes first, because that's what often freaks people out the most. If they go into an environment with a patient, they're like, oh my gosh, what am I supposed to do first? Oh my gosh, I don't, did I even ask the patient what the name was? Did I hear it? Oh my gosh, I don't have the vacuum cleaner. So practice this when you're at home. Sound crazy to your family. Hi, Mr. Sylvia, my name's Deborah. Okay, go through the whole process. Practice pulling everything out, set everything aside. That was a huge thing for me when I got out of nursing school, was keeping a mental checklist of all the things I needed for whatever skill it was. So I always had a fear that I, like you said, I forget something, I'm not gonna find a thing. Practice now, so that then once you go out and do it, it feels a little more comfortable. Then you're dealing with only completing the skill. We're not trying to remember your checklist as much. But
I'm gonna need to buy it. I need a lot of practice.
These things are so cool. I was messing with mom last night. Question.
I'm still there.
If you, when you go home, try to set this up how you go on. Or if you strap this to something arms to practice, let them speak. So that's part of it, is that it's just, if it were pumping, it would go through your brain. It's not a perfect contraction. I'm less worried about you seeing the drawback of blood, because once you use those back containers, you're not going to see it, you're not going to pour it. If you're using a syringe and trying to back, you can see it, which you're welcome to do that. You have a syringe in here with a needle. You guys can try that at home. Use that syringe and needle in practice, and then hold on to the syringe, hold on to the hub of the syringe, draw back, and you will see the blood come in. Try that one too. That's the old style way of drawing blood. Then you have to draw it back. You have to discard that needle. You have to remove it. But in here, you'll have either 3 or 5 millimeter syringe, and then you're going to have a straight needle with a dart right at the bottom. There. There's another one. Yep, so that one, and then there's a straight needle. Let me go grind some more. That's good for you. I think it's like insane.
I have a promise, she said too.
So neat. They're gonna be like, love that one.
Yeah, it
So, okay.
no air. Are you not getting blood in your arms?
Yeah, I'm like it.
Hold it like this with this piece facing upward.
Yeah, but I don't know if I've done, I don't know if I'm actually putting it in the middle.
But I didn't get no blood in my arm, but now I'm seeing the blood, there's no air in my arm at all. By me holding it and squeezing like this, I don't know, just squeezing this little bottle. I done got all the air out of it now. Cause she said she has some time, so that's probably the thing is. Yeah, maybe that is important.
This workshop with the policy. No, I mean, go home.
Oh, like the big one. We're putting
Well, putting
everything.
everything here, yeah, right, and then we put the bigger and what we discussed.
Okay, these are situational feedback. I'm giving you guys part two, so you can practice at home.
All right, questions, concerns? Oh, no, we're not gonna really. Tell me something good. Oh, it's good and bad. Okay, my last child moved out. Oh, so bittersweet. Yeah. No fun.
No, he's the one in house to see. He's doing okay. Good.
Is he wearing a mask yet? Yeah, well, I don't know at this point. I'm trying not to be mom, you know, nag mom. Yeah. Trying not to love him when he does that. It's very hard.
I don't think I'll be good.
Yeah. I know.
All right, tell me how to tell me something good.
I tested negative for COVID.
Yeah, that's always awesome. How long did you have to wait for your results?
4 days, so I was quarantined for 4 days in the house.
The whole family? The whole family had
Pretty
quarantine?
much. So like, I would get my medicine or food passed through the door. I would just come out to take a shower and I had to go back and disinfect each time, you know, and then, yeah, it was challenging.
I'm so glad.
Yeah.
Anybody else have anything good?
My brother got married.
Woo! Cool. Was it, did they have a celebration?
Yes.
Really?
Yeah.
Where did you get married at?
It was Hollywood, Maryland.
Oh, wow. Okay. Did they get you all honeymoon?
I don't know yet.
At least
I was there to do one thing. I
you
did it
showed
well.
up, right?
I broke the seal.
So are you the best man?
No, but I was one of the three. Then.
There you go.
The middle brother got to be best man.
Okay, so you're one of the three. Youngest teacher. Very cool. Prettiest. Best hair, best hair.
Best hair.
And the tallest.
Oh, well, there you go. Where do you get your height from? Your mom or your dad?
Yeah.
Yeah.
They're both short.
With an outlier.
Yeah, pretty naked.
Hey, the good thing is your cheeks will fit for a green one.
That's right.
All right, go ahead. Who else still needs to practice on the arm? Lucia, have you practiced on the arm? Okay. Okay, we got some more. So the stuff that you're not using right now, if you want to keep practicing on your arm, go for it. If you're ready to pack your stuff up. But what I would suggest you do is put your arm into the box, and I would also put a straight needle cap in the box. So it's not floating around in your bag, okay? So straight needle cap with the vacuum cleaner, with your tube, and blood and arm into your box. Put it all in. That's fine. Yeah, if you want to keep it in the air container, that's fine. Just keep it somewhere separate and then loosen the bag.
But when is it now? Oh, this one? Yeah.
You'll make sure these are plants, so.
So this one, and remove that one.
Have two layers
Right
there.
out. The green here. Right.
Look up here.
Yeah, there you go.
Got it? Okay, good.
And then just go to the one.
Oh, I got it.
And what do we do with the
So
butterfly?
this butterfly, we're gonna, I'm gonna go get a trash container and I'm happy to discharge your butterfly and you just up here.
Okay.
Because those are too hard to do. These are on me.
Where's the butterfly needle?
Who else has something good?
Well, we celebrated my grandson's birthday party this weekend. He was 5 and he's all excited.
Is he
He's back now.
kindergarten?
5. Huh?
Is he kindergarten?
Yes.
Are we, what's the big year? You want the whole, so we're not keeping the butterfly? No, discard those right into the sharps. Keep your napkin finger though. Oh, no, it's okay, I'll get you another one.
I have to.
You have to, okay, perfect. And then everything that's in your black container, I want you to put in the biological bag. Once you pack up needles, then you can start. If you need another pair of gloves, well, you have your sterile gloves, so you use sterile gloves for practicing. You need a
Smaller pair.
who else need a smaller? You need a larger, small. Got it. Okay, who wants to practice up here on the arm?
Can I have more?
Whatever
photos
you
with
can practice
enough?
with.
Okay.
On the arm. Practice bring your butterfly and your straight needle.
I just put my butterfly in.
That's okay, just straight needle. That was a lot easier on the arm.
So do we need to bring our tube too?
Yep. And bring your turn so you can practice time.
No.
What you got there?
There's not any. Yeah, you said everything.
I wanted you guys to see his arms, so you realize how cool your arms are.
Oh my God.
Yeah, so if you know anybody that's I'm not kind of bad. But these are, yeah, really hard to see. So, guys got to get in the wheel. Cool.
We put the whole box in there.
What did that? Put everything in the bag. Yep, everything. Just dump it in. Just be careful, make sure all the needles are capped. I don't want you to get poked. Yep. Oh, yeah.
Yeah.
Everything is, yeah. The other container, though. I'm sorry, I didn't make that noise. I said yes before I realized what you were saying. Sorry. Leave the black container, just dump the rest of the stuff in. Trick or treat. Yeah, just never mind. So why?
Now, how about that? I guess. And then just.
Oh, really?
Yeah.
There. Right, right.
Yeah, it's going.
That's really weird, because I did that on the first try on that.
Have you?
And what did you know? What did you know?
Well, mine was recent, like, mine was been-
My person was doing anything that started.
I got it on my arm.
Maybe not on the floor. It is, but. Yeah.
Yeah. I'll take it. Connected. I don't want. I'll show you which one had Susan from me. I got it down to Susan. Yeah. It's a beautiful family. Thank you. My oldest, that's my second oldest, my third oldest.
And he just moved out. The baby. Oh, yeah.
He, I don't know if you ever heard Camp Red Arrow. He's moved there. He's gonna be, fitness director. He's only 19, but he can fix things.
Okay.
And then he's going to school twice a week for, to be a machinist.
Oh.
So, but, this position pays right now, but then come, I think January, he's got that. He'll have to do like a missionary, and he'll have to go up to Turkey and raise funds. And I said, well, let him do it now, because he gets picked up in terms of 21.
Yeah.
So I said, well, let him get out of the system while he's still on insurance. And then keep telling him you got that insurance. You know. So good compared to trying to connect with the hotspot.
Yeah.
Oh my gosh, people don't have it. The first one was hard, the hardest to move out than the last one. I mean, it was hard for the other two, but not like the first one.
Right.
The first one you.
All right, who else needs to, does anybody else want to practice on the iron? Hang tight for just a minute. If you don't want to have any trash, go ahead and throw that now.
For the chapter introduction, all it is. Is that all it is? On the chapter introduction?
Yeah, chapter 1 and 2.
That's it.
That's what she said. That's what, I mean, that's what I.
No, I mean, but that's all you pull up, isn't it? It says chapter introduction at the beginning, and then I clicked on it, and that's all it was.
Yeah.
Oh, here's, I clicked on lecture once. That's all I get. Oh, okay, and that's all it is?
Or you can hit the play button and it'll play through.
Oh, okay. So we don't have to have.
this-
No. And we can write these down if you want, we don't have to write them on here, right?
Right. Yeah. You can do that and then it'll be on here. And then if you exit.
So what?
Yeah. You can go in and flash. And then you can-
These are, some of these you write, do it, if there's a thing under, so the fine, it says, these are, I don't have any examples. But you can, if you don't make the 100 or whatever, you can go back and hit that and redo the whole thing. I wish I had a book. It's so much.
The whole middle part, you know.
Amazing how much easier things are when you have internet. Instead of a hot, everybody goes, well, use your hotspot. My hotspot's lousy. You're able to get on board?
Oh, for me, for, no, she's gonna walk me over everything, hopefully, but, I mean.
Hi, guys. Everybody, good seeing everybody. These are top secret medical items that we need for our first student. So you are not allowed to open these containers until our first student. Okay? Don't even think. You cannot think. You can open them. Okay? Give them over safe. You're very cold. Don't think. Okay, you guys are all set to go. Except for ones that want to look at Cengage and your blood pressure. Oh. Beautiful. Thank you. So on they're all one house.
Yeah, they're all in piece 30.
I got a question.
Yeah.
You want me to do anything with them?
Yeah. I will.
I'll
Okay, questions or more comments? So next Tuesday, 9 o'clock on Zoom, okay? If you don't see me right at 9, no, I'm coming. On the way, I'm stuck at a stoplight, okay? So, I close mine. If we see that a lot of people are traveling to get on, we'll push it a little bit later, okay? So plan for 30 minutes. Next Tuesday, 9 o'clock Zoom, okay? And every week, after Sunday night hits, your material will be available until the next Sunday for that week. So that schedule that I gave you guys at the beginning of the semester is still correct for virtual. I will resend that calendar so that everybody has it again. Plan for our first test to be on October 6th. All of our tests are closed book, okay? I don't want you looking at your notes. I don't want you trying to access your full book while you're taking the test, because I want you guys to practice this information. You're not going to be able to cheat when you get to sit for your certification, okay? Other thing that Robin just mentioned, we are still trying to plan for clinical. We are hoping to go forward with that. If so, we do have to figure out the chamber printing side of it. That has to be done before you guys go into any sort of medical office. So more information to come on that. We're just leaving it to be determined right now, but I will be in touch with you. We'll talk about it on Zoom. Other thing I want you guys to do is email me and tell me what you want for your group project topic, include in your group. Last thing, when you sit for your certification exam in January, we're going to have 2 Saturday dates. As of right now, as long as nothing happens with the governor changing the fact in earlier phases, Rappahannock County High School, which is right down the road, is where the testing site will be. You will be required to wear a mask. You will go in there. You have 3 hours to take the test. It will be on a laptop. To be able to sit for that test, all of your skill kit has to come back first, okay? Because we've had issues with former students not bringing everything back. So if you have a Chromebook out or if you have a skills kit out, that has to come back before you sit for the certification test, okay? Awesome. Questions? All right, I'll see you guys next week then, virtually.